3 weeks ago, Maria received a call that changed everything. Her mother, an active and cheerful 68-year-old woman who lived alone, had tripped on the living room rug while carrying a cup of coffee. A simple stumble. Nothing dramatic. She didn't even lose her balance completely, she just leaned her hand on the table to keep from falling. But that night, when Maria went to visit her, she noticed her mother complaining of hip pain. The next day they were in the emergency room. 48 hours later, her mother was in the intensive care unit with complications that neither of them had imagined possible. Maria couldn't stop wondering how something so simple, so everyday as a small stumble, had triggered a cascade of events that put her mother's life at risk. This story repeats itself thousands of times every year in hospitals around the world. And the question many families ask themselves is exactly the same one Maria asked: how is it possible for a seemingly harmless stumble to end with an elderly person in intensive care? The answer is not simple, but understanding it can literally save lives. Because what seems like a minor accident in a young person can, in someone over 50, trigger a series of medical complications that health professionals know very well, but families rarely anticipate. Let me explain something fundamental that happens in our bodies after age 50. Our bones are not the solid, unbreakable structures they were in our youth. Over the years, especially in women after menopause, bones lose density. It is as if they were a sponge that gradually becomes more porous. This process is called osteoporosis, and it affects millions of people over 50 worldwide. The worrying thing is that it is silent. It doesn't hurt. It shows no symptoms. A person can have significantly weakened bones and feel completely normal until that stumble occurs. When a young person trips and falls, their bones generally withstand the impact. Bruises may appear, perhaps some muscle pain, but nothing serious. However, when a person with osteoporosis suffers the same fall, even a fall from their own height, the result can be completely different. The fractures that most frequently send older people to the intensive care unit are those of the hip, spine, and femur. Pay close attention to this point: a hip fracture in an elderly person is not at all comparable to the same fracture in someone young. Let me tell you about Carlos, a 72-year-old man who tripped getting off the bus. He literally took a wrong step. The impact seemed minimal to him. He felt pain in his hip but thought it would pass. He waited 2 days before going to the hospital because he didn't want to bother his children with something he considered minor. When he finally reached the emergency room, he not only had a hip fracture but had developed pneumonia from remaining almost immobile in his bed during those 2 days, trying to let the pain pass on its own. Immobility in older people is extremely dangerous, and this leads us to the heart of the problem. When an older adult fractures their hip or femur, they generally need surgery. And this is where the situation complicates in ways many people do not anticipate. Surgery itself is a procedure that an older person's body tolerates differently than a younger person's. During and after the operation, the body experiences considerable stress. The immune system weakens temporarily. Blood pressure can become unstable. The kidneys, which may already have been working less efficiently due to age, now have to process anesthetic medications and potent painkillers. But wait, because the story gets even more complicated. During hip or femur surgery, small fragments of fat from the broken bone can enter the bloodstream. In some cases, these fragments can travel to the lungs, causing what is known as a fat embolism. This is a serious complication that can make breathing difficult and require intensive care. It doesn't happen in every case, but it is a real risk that doctors monitor constantly. Now, let me tell you about something health professionals call deconditioning syndrome. Imagine you are used to walking every day, moving freely around your house, doing your normal activities. Suddenly, due to a fracture in surgery, you must remain in bed for several days. Every day of immobility in an older person has profound consequences. Muscles begin to weaken with surprising speed. Lung capacity decreases. The heart has to work harder to pump blood that is no longer being aided by the muscle movement of the legs. It is as if the body forgets how to function optimally. Teresa, a 65-year-old woman I interviewed to better understand these situations, told me about her experience. She was a yoga teacher, in excellent physical shape for her age. One day she slipped in her bathroom while getting out of the shower. Hip fracture. After surgery, she developed what doctors call nosocomial pneumonia, a lung infection acquired in the hospital. Why did this happen to someone so active and healthy? Because when we lie down for long periods, secretions accumulate in the lungs. We don't cough as effectively. We don't breathe as deeply. And bacteria find a perfect environment to grow. Pneumonias in hospitalized older people are extraordinarily common and potentially lethal. The immune system is already weakened by surgery. Antibiotics that might be used for other infections may have altered the normal bacterial flora, and the body simply doesn't have the same defenses it had decades ago. When an older person develops pneumonia after hip surgery, the probability of needing intensive care increases dramatically. They may need supplemental oxygen, potent intravenous antibiotics, and in severe cases, mechanical ventilation. But there are more factors at play, and it is crucial that you understand each of them. Many older people take several medications for chronic conditions like hypertension, diabetes, thyroid problems, or high cholesterol. When they suffer a fracture and need surgery, all these medications have to be carefully managed. Some must be temporarily suspended. Others must be adjusted. New medications for pain and infection prevention must be added to the mix. This complex interaction of medications can cause unexpected side effects. Blood pressure can drop dangerously. Blood sugar levels can spiral out of control. The kidneys can begin to malfunction. Let me explain something many doctors see frequently but families rarely know about: postoperative delirium. After surgery, especially in people over 65, a state of acute confusion can appear. The person does not know where they are, does not recognize their family members, may become agitated or, conversely, extremely drowsy. This is not a simple effect of anesthesia that passes in hours. Delirium can last days or even weeks, and it is both a symptom that something is not right in the body and a factor that further complicates recovery. A confused person may try to get out of bed without help and fall again. They may pull out 4 lines. They may refuse to eat or drink. All of this prolongs hospitalization and increases the risk of complications. Now I want you to understand something absolutely critical about the circulatory system in older people. With age, our veins become less elastic. Blood tends to circulate more slowly, especially when we are immobile. After hip surgery, when the person must remain in bed or has very limited mobility, there is a significant risk of blood clots forming in the legs, a condition called deep vein thrombosis. These clots are dangerous on their own, causing pain and swelling, but the true danger occurs when a fragment of that clot breaks off and travels through the bloodstream to the lungs, causing a pulmonary embolism. Pulmonary embolism is one of the most feared complications after orthopedic surgeries in older people. It can cause sudden respiratory distress, chest pain, and in severe cases, it can be fatal. This is why you will see that hospitals use preventive anticoagulant medication, compression stockings, and insist so much that the patient starts moving as soon as possible after surgery. Every measure is designed to prevent this potentially deadly complication. Roberto, a 70-year-old retired engineer, never imagined that a trip on the stairs of his house would lead him to spend 3 weeks in the hospital, one of them in intensive care. His hip fracture seemed to be healing well after surgery. But on the 5th day, he developed a pulmonary embolism. Doctors detected that his oxygen saturation was dropping. They performed studies that confirmed the clot in his lungs. He needed high concentrations of oxygen and potent anticoagulants. His family told me it was terrifying to see how something that had started with a simple misstep had turned into a struggle for his life. Let me talk to you now about something many people don't consider: nutritional status. After a fracture and surgery, the body needs enormous amounts of energy and nutrients to heal. It needs protein to repair tissues, calcium and vitamin D for the bone to consolidate, and iron to replenish the blood lost during surgery. But many older people already have nutritional deficiencies before the fall. Maybe they eat less because they live alone and have no motivation to cook. Maybe they have dental problems that make chewing difficult. Maybe they are taking medications that affect their appetite. When the time comes to heal from a fracture, their body simply doesn't have the necessary reserves. Malnutrition in hospitalized older people is a serious problem that significantly complicates recovery. Wounds heal more slowly. The immune system functions worse. Muscle mass is lost even more quickly. And it creates a vicious cycle. The person is weak because they don't eat well, and because they are weak, they have no appetite or energy to eat. Hospitals try to combat this with nutritional supplements, but it is not always enough, especially if the person develops nausea from medications or simply refuses to eat due to delirium or depression. Let's talk about something frequently overlooked: the emotional and psychological impact. An older person who was independent, who lived in their own home, who took care of themselves, suddenly finds themselves completely dependent on others for the most basic functions. They cannot go to the bathroom alone. They cannot bathe. They cannot dress. This blow to dignity and independence can cause deep depression. And depression in older people is not just sadness, it physically affects the ability to recover. Depressed people eat less, sleep poorly, and have no motivation to participate in physical therapy, which is crucial for their recovery. Some studies show that depression after a hip fracture can increase the risk of complications and death. Now I want you to understand why infections are so dangerous in this context. In the hospital, despite all hygiene protocols, there is a risk of acquiring infections. It could be a urinary tract infection from the use of a catheter. It could be an infection at the surgery site. It could be the pneumonia we already mentioned. In a young, healthy person, these infections are treatable and generally resolve without major problems. But in an older person, especially one already weakened by surgery and other factors, an infection can trigger what is called sepsis. Sepsis is an exaggerated response of the immune system to an infection. Instead of only attacking the bacteria, the immune system begins to attack the body's own tissues. Blood pressure drops dramatically. Organs begin to fail. The kidneys stop filtering properly. The heart cannot maintain circulation. The lungs fill with fluid. Sepsis is a medical emergency that requires immediate intensive care, with broad-spectrum intravenous antibiotics, fluids to maintain blood pressure, and frequently, medications to sustain heart function. Despite aggressive treatment, sepsis in older people has a significant mortality rate. Let me tell you about Elena, a 74-year-old woman who tripped on the curb while leaving the supermarket. Femur fracture. Successful surgery. But on the 8th day after the operation, she developed a fever. Tests showed a urinary infection that quickly progressed to sepsis. Her blood pressure dropped to dangerous levels. Her family saw her connected to multiple infusion pumps, with monitors constantly beeping, and doctors and nurses coming and going from the room. Elena survived, but spent 10 days in intensive care. It all started with a trip while leaving the supermarket. Now I want to explain something about the heart and how it responds to the stress of a fracture in surgery. An older person's heart does not have the same reserve as a young person's. It may already have some degree of coronary disease, even if the person doesn't know it. During surgery and recovery, the heart is under stress. It needs to pump more blood, but it may be receiving less oxygen due to anemia from blood loss during surgery. It may be affected by changes in electrolytes in the blood. It may be responding to the pain and anxiety the person experiences. All of this can precipitate what is called a cardiac event, a heart attack or a dangerous arrhythmia. Heart attacks after orthopedic surgeries in older people are not rare. They can occur during the surgery itself or in the following days. Sometimes the symptoms are clear: chest pain, shortness of breath, sweating. But in older people, symptoms can be atypical. It may just be confusion, extreme weakness, or nausea. Because of this, hospitals constantly monitor electrocardiograms and cardiac enzyme levels in the blood of older patients who have had surgery. There is another factor I want you to understand because it is crucial: time. Every hour that passes between the fall and proper treatment matters enormously. When an older person falls and fractures something but waits days before seeking help because they don't want to bother anyone, or because they think the pain will go away, or because they are afraid of hospitals, they are allowing complications to develop. Intense pain causes stress on the body. Immobility allows clots to form. Dehydration can set in if the person cannot move to drink water. Pressure ulcers can start to form on the skin. Each of these complications makes eventual treatment more difficult and risky. Let me share the story of Alfonso, a 69-year-old man who fell on a Saturday morning at his home. He lived alone. He didn't want to call his daughter because he knew she had plans that weekend and didn't want to ruin them. He waited until Monday, when his daughter called him as usual. By then, Alfonso had been lying on the floor for nearly 48 hours. He was severely dehydrated. He had developed pressure ulcers on his hip and heel. His kidneys were failing from dehydration and the pressure of the body on the muscle, which releases toxins when damaged. He spent 5 weeks in the hospital, 2 of them in intensive care. All because he wanted to avoid being a bother. Now, after understanding all these factors, I want to talk to you about prevention, because this is the most important part of everything I am telling you. Falls in older people are not inevitable. They are not simply a part of aging that we must accept. There are concrete, practical measures that can dramatically reduce the risk of falls and their devastating consequences. First, let's talk about the home environment. Most falls in older people occur at home, in places that should be safe and familiar. Loose rugs are death traps. Electric cords crossing the floor are hazards waiting to happen. Poor lighting makes it difficult to see obstacles. Slippery floors in bathrooms are especially dangerous. But all these risks can be eliminated or minimized. Remove loose rugs or secure them firmly. Organize cords. Install night lights in hallways and bathrooms. Place grab bars in the shower and near the toilet. Use non-slip mats in the bathtub. Regular medical checkups are absolutely crucial. Many falls occur because the person has vision problems that have not been corrected. A simple eye exam and updating glasses can prevent falls. Balance problems can be evaluated by doctors and physical therapists. There are specific exercises that improve balance and leg strength, reducing the risk of falls. Tai Chi, for example, has shown in scientific studies that it significantly reduces the risk of falls in older people. Medications should be reviewed regularly with the doctor. Some medications cause dizziness or drowsiness, increasing the risk of falls. Some blood pressure medications can cause sudden drops in pressure when standing up. If you are taking several medications, your doctor should review if any can be discontinued or if the doses can be adjusted. Never stop medications on your own, but do discuss with your doctor if you feel dizzy or unstable. Osteoporosis can and should be detected before it causes a fracture. There are simple studies called bone density scans that measure the density of the bones. If osteoporosis is detected, there are treatments that can strengthen the bones. Vitamin D and calcium are important, but they are not enough alone if there is significant osteoporosis. There are specific medications that your doctor can prescribe. Pay attention to this point: osteoporosis is not just a women's problem. Older men also develop it and should be evaluated. Regular exercise is one of the best defenses against falls. I'm not talking about strenuous exercise. Walking regularly strengthens the legs and improves balance. Resistance exercises with elastic bands or light weights maintain muscle strength. Yoga or stretching maintains flexibility. Consult with your doctor before starting any exercise program, but understand that staying active is fundamental to staying independent. Proper nutrition is essential. Make sure you consume enough protein to maintain muscle mass, and calcium and vitamin D for your bones. If you have difficulty cooking or have no appetite, talk to your doctor. You may need nutritional supplements. Malnutrition makes you more vulnerable to falls and to complications if you do fall. If you have medical conditions like diabetes, ensure they are well controlled. Low blood sugar levels can cause dizziness and falls. Poorly controlled diabetes can damage the nerves in the feet, affecting balance. Blood pressure should be at appropriate levels, not too high and not too low. Now, let me tell you something crucial: what to do if you or a loved one falls. If the person cannot get up, do not try to force them to stand. Call emergency services immediately. If there is intense pain in the hip, leg, arm, or any other part, do not move the person. Cover them with a blanket to keep them warm and wait for the paramedics. If the person hit their head, it is especially important not to move them. If the person can get up and does not seem to have fractures, it is still important to observe them carefully. Is there pain that gets worse? Swelling? Difficulty walking or using a limb? Confusion? A headache that worsens? Any of these signs requires urgent medical evaluation. Do not wait days to see if it improves. The first hours after a fall are critical. I want to emphasize something I have mentioned several times but is so important it deserves repeating: never, ever wait days to seek medical attention after a significant fall. I understand the fear of hospitals. I understand not wanting to bother your children. I understand the desire to minimize what happened. But the consequences of waiting can be catastrophic. I have seen too many cases where early evaluation and treatment would have prevented weeks of hospitalization and suffering. For families, I want you to understand that fall prevention should be an ongoing conversation, not a one-time talk. Visit your parents' or grandparents' homes with a critical eye. Is it safe? Are there good handrails on the stairs? Do the bathtubs have non-slip surfaces? Is the lighting adequate? Don't wait for a fall to occur to make these changes. And if your loved one has already had a fall, even if it didn't result in a serious injury, take it as a serious warning. Investigate why it happened and what can be done to prevent the next one. I also want to talk to you about the importance of medical alert systems. For older people living alone, a medical alert device, whether a necklace or bracelet they can press to call for help, can literally save lives. Yes, they cost money. Yes, some older adults resist using them because they feel they are admitting weakness. But the cost of that device is insignificant compared to the human and financial cost of a fall where the person is trapped without being able to ask for help for hours or days. Let me share something that geriatricians, specialists in the care of older people, have told me repeatedly: frailty does not appear overnight. It is a gradual process. A person who 6 months ago walked with ease but is now noticed to be slower, more hesitant, and who holds onto furniture when walking through the house, is showing signs of increasing frailty. These signs should not be ignored. They are moments to act, to consult with the doctor, to evaluate strength and balance, and to intervene before the fall occurs.